I'm Tony Nguyen. I'm a sports medicine physician at the Core Institute, specializing in shoulder, knee, and trauma. I started my sports fellowship at Baylor Medicine in Houston, and my residency was at Cleveland Clinic and the Detroit Medical Center. Medical school was at George Washington University in Washington, D.C., and I did my undergraduate at the University of Virginia. I liked helping people. I knew I was going to do something in the science field. I didn't know if I was going to be a lab rat or go into medicine, but I enjoyed interacting with people too much to be stuck behind a test tube all day. I chose to specialize in shoulder, knee, and trauma because I found them to be the most interesting joints. They're the most affected joints for sporting injuries. My care philosophy focuses on the patients. I want to do what's right for them and try to get them back into full activity as fast as possible without causing undue harm. My role in the care continuum of the patient is, I believe, as a liaison to help the patient understand what's going on, what their treatment options are, and how we can achieve their goals. As a sports medicine physician, I typically see patients that are wanting to go back into activity. I see all age groups. They typically have knee pain, shoulder pain, sometimes elbow pain, or they're just having difficulty doing things that they were accustomed to doing. And those are the type of patients I'd like to see. And we try to do what's best for the patient to try to get them back into their activities, whether it's high risk sports like basketball, football, or whether it's just getting back and hiking and enjoying the outdoors. For example, I had a patient who basically injured all four knee ligaments to his knee, and I was working the Phoenix Marathon, and he came in and he recognized me, and this was a patient that I wasn't sure was going to walk without a limp, and there he was running a marathon and finishing in great time. So that was very rewarding. The most common conditions I see in my clinic would be ACL injuries, meniscus injuries, rotator cuff injuries, and other injuries with the shoulder, such as shoulder dislocations and labral tears. The most rewarding thing about being a physician is making a difference in patients' lives and seeing them get back into doing what they love doing.